Attention Deficit Hyperactivity Disorder, ADHD. The basics. Do you find it hard to pay attention? Do you feel the need to move constantly during times when you shouldn't? Do you find yourself constantly interrupting others? If these issues are ongoing and you feel that they are negatively impacting your daily life, it could be a sign of Attention Deficit Hyperactivity Disorder, ADHD. ADHD is not just a childhood disorder. Although the symptoms of ADHD begin in childhood, ADHD can continue through adolescence and adulthood. Even though hyperactivity tends to improve as a child becomes a teen, problems with inattention, disorganization, and poor impulse control often continue through the teen years and into adulthood. Warning signs. People with ADHD show an ongoing pattern of 3 different types of symptoms: difficulty paying attention, inattention, being overactive, hyperactivity, acting without thinking, impulsivity. These symptoms get in the way of functioning or development. People who have ADHD have combinations of these symptoms. Overlook or miss details, make careless mistakes in schoolwork, at work, or during other activities. Have problems sustaining attention in tasks or play, including conversations, lectures, or lengthy reading. Seem to not listen when spoken to directly. Fail to not follow through on instructions, fail to finish schoolwork, chores, or duties in the workplace, or starts tasks but quickly lose focus and get easily sidetracked. Have problems organizing tasks and activities, such as doing tasks in sequence, keeping materials and belongings in order, keeping work organized, managing time, and meeting deadlines. Avoid or dislike tasks that require sustained mental effort, such as schoolwork or homework, or for teens and older adults, preparing reports, completing forms, or reviewing lengthy papers. Lose things necessary for tasks or activities, such as school supplies, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and cell phones. Become easily distracted by unrelenting thoughts or stimuli. Forgetful in daily activities, such as chores, errands, returning calls, and keeping appointments. Showing these signs and symptoms does not necessarily mean a person has ADHD. Many other problems like anxiety, depression, and certain types of learning disabilities can have similar symptoms. If you are concerned about whether you or your child might have ADHD, the first step is to talk with a healthcare professional to find out if the symptoms fit the diagnosis. The diagnosis can be made by a mental health professional, like a psychiatrist or clinical psychologist, primary care provider, or pediatrician. Treating ADHD. Although there is no cure for ADHD, currently available treatments may help reduce symptoms and improve functioning. ADHD is commonly treated with medication, education or training, therapy, or a combination of treatments. Education and training. Children and adults with ADHD need guidance and understanding from their parents, families, and teachers to reach their full potential and to succeed. Mental health professionals can educate the parents of a child with ADHD about the condition and how it affects a family. They can also help the child and his or her parents develop new skills, attitudes, and ways of relating to each other. Examples include parenting skills training teaches parents the skills they need to encourage and reward positive behaviors in their children. Stress management techniques can benefit parents of children with ADHD by increasing their ability to deal with frustration so that they can respond calmly to their child's behavior. Support groups can help parents and families connect with others who have similar problems and concerns. Adding behavioral therapy, counseling, and practical support can help people with ADHD and their families to better cope with everyday problems.